Hey everyone, we're going to talk about something that I'm sure many of us have gone through. That moment you find a new lump or bump on your skin and your mind just starts racing. Understanding what you're actually dealing with is the first step to getting some peace of mind, and that's exactly what we're here to do today.
Okay, so let's get right into it. You've found something new on your skin, and immediately the questions pop into your head. What is this? Is it serious? Will it just go away on its own? We're going to break down the most common things it could be and, most importantly, help you figure out when it's time to stop wondering and actually talk to a doctor.
First things first, let's just get the names right. You'd be surprised how much anxiety disappears just by knowing what these things are called and what they're actually made of. Knowledge is power, right?
So, a lot of the time, what you're feeling is one of these two things. On one hand, you have a cyst. Just think of it like a tiny, self-contained pouch under the skin that's filled with fluid. On the other hand, there's a lipoma, which is just a soft, harmless little lump made up of fatty tissue. Both are super common and usually found right below the skin's surface.
Now, an abscess, this one's a whole different ballgame. This isn't just a simple growth, it's an actual infection in one spot. And that's exactly why it usually hurts. It gets red, swollen, and tender to the touch. Because it's an active infection filled with pus, it's not something you want to ignore. It really needs to be drained by a professional to heal up correctly.
Then, of course, you've got things we're all familiar with, like moles and warts. The medical term for these is skin lesions. Most of the time, they're completely harmless. They might just be a cosmetic thing you don't love, or maybe they're in a spot where they get rubbed or irritated by your clothes.
All right, so here we are at the most important part. How do you know when to stop watching and waiting and when to actually make that appointment? This is the crucial decision point, so let's look at the signs.
Think of this as your go-to checklist. The single most important word here is change. If a lump is growing or suddenly starts to hurt, that's a sign. If a mole changes color or starts bleeding, that's a sign. A lump that's swollen and painful, that could be an abscess. Basically, if something's not staying the same or it just won't heal, that's your cue. Time to get it checked out.
And here's some really good news. If it turns out you do need treatment, it's usually a very simple procedure that happens right there in the doctor's office. It's not a huge ordeal. So let's demystify it and break down exactly what you can expect.
The whole thing is really straightforward. First, and most importantly, they completely numb the area so you won't feel any pain. Then, the doctor does what needs to be done, maybe draining an abscess or fully removing a cyst or lesion. After that, they close the area up neatly. Sometimes, they might send what they removed to a lab for a biopsy just to be 100% sure. And finally, you get a clear plan for how to take care of it at home so it heals up perfectly.
Okay, it is totally 100% natural to have a bunch of questions running through your head when you think about any kind of procedure. So let's just tackle the most common ones right now.
This is it. This is always the number one question, right? Is this going to hurt? It makes perfect sense to ask, especially if the spot is already a little tender.
And the answer is a huge relief. The entire procedure is done using a local anesthetic, which means that one specific area is made completely numb. You really shouldn't feel any pain at all during the procedure itself, just maybe a little bit of pressure.
This is another really big one. I mean, if you're going to have something taken care of, you want to know if it's gone for good, right? Is this a permanent fix?
And the great news is, yes. When a skilled physician completely removes the entire thing, like the whole sac of the cyst, the chance of it ever coming back is really, really small. This is exactly why getting it done professionally is so much more effective than trying something at home.
So what about getting back to your normal life? Are we talking about a lot of downtime here?
For most of these simple procedures, you're looking at a pretty quick recovery. We're talking about 1 to 2 weeks for everything to heal up. Of course, that might change a little bit depending on the size and where it is on your body, but it's generally not a long time at all. So if you're looking for a place to get this done, this chart kind of lays out the gold standard. You want fully licensed expert doctors. No question. You need a completely sterile environment to keep you safe. And then there are the things that just make the whole experience less stressful, like having a lab right there for quick results or being able to get an appointment right away, so you're not stuck worrying for weeks.
And honestly, this quote just says it all perfectly. The whole point isn't just to remove a lump. It's about restoring your comfort and, just as important, your confidence. It's about getting that peace of mind back and doing it all without putting your life on hold.
So I'll just leave you with this final thought. Living with an unknown on your skin can create so much background noise and anxiety in your head. Getting a quick professional diagnosis can just replace all that uncertainty with a clear answer and a simple plan. So, isn't it time for that clarity?